The interesting thing is some people, the minority of people, don't have any symptoms, and that's kind of scary. But most of us do have some type of symptom. The number one symptom is what we call angina or angina, however you want to pronounce it. It's described as a tightness or heaviness or pressure over the upper middle chest, usually comes on with activity and goes away with rest. The second most common symptom, which is more common in women, is shortness of breath with exertion. We call this also decreased exercise tolerance. Like earlier today, a patient told me, the last 3 months, every time I go up the stairs, I'm just exhausted and winded, and something's not right. I wasn't like that 3 months ago. So that's also a sign of blockage, or could be. I should say could be a sign of blockage. So those are the two biggies: tightness in the center of the chest and unexplained shortness of breath doing simple things.